Kia ora, whānau. So let me just bring up my screen here, if I can find it. That's a good question. Okay, here we go. So as Grant's already said, this is a little bit of an interesting topic and one that Grant asked me to consider talking about. And it's about misinformation and disinformation in health. I guess it stemmed from our last webinar, which was on COVID, and the number of different theories and so on and so forth that get circulated around in the community. And whilst you might think, yeah, well, that's got really nothing to do with smoking cessation, I think it's fair to say there have been a number of there has been misinformation in some of the aspects of smoking right back in the past, but also now with vaping and where it sits. And somehow we've got to work our way through all of this to try and give people clear and evidence-based information, or at least truthful information where we can find it. So just a quick bit on definitions to start off. Misinformation is wrong information, or the fact that people are misinformed. That often stems from the same source, where they hear something or they see something, often on social media, and they'll say, you know, I heard that vaping, for example, is just as harmful, if not more harmful than smoking. So that's misinformation, right? So you've got, you can correct this because you know that that's not the case, and the evidence in terms of vaping in this case, we know that it's less harmful than smoking on a whole. Exactly how much less harmful, that's what we're still working on. Now, disinformation is wrong information that's spread particularly in order to deceive people. So there should be two in there, not or. So this would be information spread aimed at giving people the wrong idea. And there's lots of that out there as well. And it's kind of difficult, isn't it? When you're bombarded on social media with a whole lot of information, trying to work out what's true and what's not. And often you have to go in and look behind, you know, what's that website about? Is it a scientific website? Is it a reputable news source? Or is it just fake news? Now, I'm going to start off here. Look, this whole presentation webinar has not got a lot of stuff about smoking specifically in it, but it sort of tells the story. And you might already know who is in this old painting. This is Edward Jenner, who essentially invented the first vaccine. So this was for cowpox. So, sorry, smallpox. So smallpox was a disease which killed somewhere between 10 and 20% of the population. Now, this was back in the late 1700s, where he essentially invented the first vaccine against smallpox. And it worked. And so that was the beginning of a long history of science now to develop vaccines for a whole host of what were very common and often deadly illnesses. But right back then, at that beginning of all of this, this is Benjamin Moseley, who is a physician and one of the first anti-vaxxers. So one of the funny things that came out of all of this was, of course, with the vaccine, they're taking essentially material from the virus and injecting it into people. That's what vaccines are, usually mild or attenuated virus particles. But because it all developed from cowpox, vaca is the Latin for cow. That's where vaccine comes from. But here's a cartoon from the day of, oh my goodness, we're injecting viral material from cows into humans. And one of these concerns that come out, and you can see it in the picture there, is a baby that's looking like a cow, or misinformation that was spread that getting this sort of vaccination, you know, you'd start sprouting horns like cows, or you'd have excess facial hair like a cow. So, you know, all this concern came out, and here's a physician that certainly, you know, knew about the risks of smallpox, but saying, hang on a minute, this is dangerous. Interestingly, as I was reading, Dr. Mosley did, of course, do inoculations, which is where you typically put some live virus into the skin. And I suspect that lots of inoculation was happening at the time, and so creating a vaccine would take away the work required to do the inoculation. So I do wonder if there was a little bit of, uh-oh, this is going to reduce my revenue stream. Anyway, more on Benjamin Mosley a little bit later. Now, perhaps what you'll be almost familiar with is the MMR vaccine, so measles, mumps, and rubella vaccine, and its proposed links to autism. So this was a paper published in 1998 from a group of English researchers and published in The Lancet. And this reportedly showed a link between the MMR vaccine and autism in children, as well as some gastrointestinal problems. Now, this paper was later retracted, and the General Medical Council in Britain ruled that the children that Wakefield, the author of this paper and the study, they were very carefully selected, and some of Wakefield's research was funded by lawyers acting for parents who were involved in lawsuits against the vaccine manufacturers. So there are some other problems with the study, but essentially it was not good research, and the paper was later retracted or removed. So this was, you know, this though, before it had been retracted, had already done a lot of damage, and you'll still hear people here in New Zealand as well that, well, you know, I don't want to, I'm fearful that MMR causes autism. And that's not the case. There's no evidence for that as well. Not having the MMR vaccination, we saw this last year with an outbreak of measles. And if you look at the measles outbreak in Samoa, you know, it caused considerably, you know, health risks for a number of young children, and of course measles can be fatal. So you know, this misinformation that spreads very rapidly can have some rather horrid consequences. And this was a I remember seeing this billboard up briefly, but this was in South Auckland, and this was, you know, an anti-vax billboard essentially. If you knew the ingredients in a vaccine, would you risk it? You know, very clear anti-vaccination message, and you can see there clearly Maori father with his baby. So really getting at, you know, sort of nibbling away at people's fear of vaccinations, which are essentially lifesaver.
Hayden, what is the motivation for groups like Waves NZ to do this? What is their motivation?
I suppose it all comes back to ideology, and you know, whether in vaccinations, you know, there's a schedule, the government encourages it. There's perhaps a little bit of you know, nanny status thing in all of this, and at the end of the day, people say, well, it's our choice, and whilst that might be the case, you know, to make a choice, you really have to be informed of the risks versus the benefits. One might argue, you know, to put up a poster that says, if you knew the risks of getting measles, would you not have a vaccination? So it sort of plays on the fear of people. And there are a whole lot of other medical conspiracy theories, you know, this whole thing about vaccinations, not just with MMR or just in the US or New Zealand or Western countries. It exists in other places as well. And as I was reading a little bit about all of this, in Pakistan, apparently, there's a conspiracy theory that the polio vaccine was a ploy designed by the CIA to make Muslim men sterile. And so Pakistan is one of the sole 3 remaining countries in the world where polio hasn't been eradicated. So kind of crazy. And you know the risks of polio. You might even know some older people that had it. And also in sub-Saharan Africa, the HIV debate there, there seems to be a conspiracy theory that HIV doesn't cause AIDS. And it's actually the retroviral medication that we're trying to roll out that's actually the culprit for these deaths in AIDS patients. So here now we've got some good medication for treating HIV, but the conspiracy theory is just the opposite. Don't take this retroviral medication because it's going to cause death. And that's really undermined some of the HIV management in that part of the world. So these things are there and rife, and you know this has been quite evident through COVID as well. And so we don't have a COVID vaccine yet, but you've already seen signs, here you go on this protest, the cure is worse than the disease. And again, I guess coming back to your other question, Grant, you know, this is about tyranny versus freedom, people telling us what to do versus the freedom to do what we like. And even around the ending lockdown and mask wearing and all of these things that I guess this is a little bit around people don't like being told what to do. But if you were well informed about the risks of COVID, and you know, COVID's not just the flu, as we've learned, COVID can have long-lasting effects. It does affect, you know, everyone. Even young people can have effects of long-lasting effects of COVID. And you know, then this gets into really bizarre stuff, which I don't even try and understand. But you know, Bill Gates is investing money into the vaccine. But something that, you know, people are believing that somehow this COVID vaccine is going to be involved in some sort of cellular communication here via calcium channels. So it's just a kind of crazy world. But so yeah, and even here in New Zealand, so this is the protest outside of Parliament. And you start getting into this whole 5G stuff. And there was a conspiracy theory that 5G, the new telephone and mobile phone technology, might increase the spread of COVID. And I don't understand the 5G conspiracy theories either, but as far as I can see, people are worried that, you know, 5G is stronger than 3G and 4G, so therefore it must be problematic to humans and animals even. You can see they stop frying our children to death. Now, what about COVID here in New Zealand? Perhaps some of you think we might be a little bit immune here. We're not. 1 in 5 Kiwis, this was a survey released last week. 1 in 5 Kiwis believe COVID-19 virus was lab-made. So 1 in 5, 20% of Kiwis believe COVID's lab-made. Now, I know this sort of came out early on and, you know, out of China, and that's where it all started. But you know, science tells us that the DNA in this virus is not going to be, it's unlikely to be lab-made. But it seems to be a good thing that it was made in the lab and someone introduced it for goodness knows what reason. And even 6% believe a vaccine would do more harm than good. Kind of crazy. I'd certainly be in for getting a vaccine to prevent getting COVID. 5% feared vaccine would contain microchips to track and control people, and 4% believe that COVID is spread by 5G mobile phone networks. So this is in New Zealand, where you know, we think perhaps we're a little bit more sensible, or maybe I'm just naive and I think that we're more sensible, but we've got these underlying fears out there, and this really makes people suspicious of healthcare. So engagement with health information. I think it's fair to say, and even hear this when I'm seeing smoking cessation clients, that sometimes you get talking about all sorts of things. I was talking to a client last week who was asking me about the meat diet. Now, I've not heard about the meat diet, but we looked it up, and indeed it's about eating just meat and nothing else. And so we were able to have this conversation about, well, that's not going to be good for you in the long term. That would severely reduce your intake of a whole range of nutrients. But people get this, and when you really want to do something to, in this case, improve or reduce your weight, people grab onto all sorts of things. And this is something that was seen in the social media. Now, it's good that people are engaging with health information, I think, but the information has to be correct, and that really means trying to get a good source of information. I think it's a little bit of something for us to remember as well. If we're sharing something, especially if we're sharing something through the services, stop smoking services, then the information needs to be factual. And I think we just need to stop before we share random news or even fake news, and think very carefully about what the implications of that might be.
It also gets very confusing for just general people like myself in the tobacco control sector when you have two tobacco control researchers arguing about a topic from totally different viewpoints. So one will be saying vaping is bad, and the other researcher will be saying, no, it's not, vaping is good. So yeah, we get confused.
You're right, Grant, and you have to be able to pick through and find out their viewpoints. So often there is a middle ground with even these researchers that appear to be on different sides of the fence. But overall they might say, well, yes, we both believe that vaping is less harmful overall than smoking. But it depends on your viewpoint. So one might be saying, well, I'm really trying to prevent the uptake of vaping in young people that don't smoke. So if you're taking from that point of view, then starting to vape is associated with potential harm, given that they don't smoke. And on the other side of the fence, you've got people saying, yeah, but we've got these people that are already smoking. Surely this would be a better way forward. And so we you could say, well, actually we are going in the same direction. But you're right, when you hear these messages, they're so different and so polarized. One could get a little bit confused on what you meant to say. So I think just pausing a little bit and trying to work out, okay, what is our key message here, or key messages? If you smoke, vaping is less harmful than smoking. If you don't smoke, don't start vaping. So you've got to get to those sort of points. The other thing with social media, of course, is that you get a whole lot of user-generated content. And that's, it might even be people posting stuff on Amazon on a review. Oh, this stuff was a miracle. This worked miracles. It cleared up the wart on my big toe overnight. I really recommend, jelly beans for big toe warts. No science behind it, just people sort of promoting based on their own point of view. And there's a lot of applications here or social media sites that can do that. This study here looked at vaccine-related pins on Pinterest. At the time, back in 2015, this was 74% of all of those were anti-vaccine. So these sites can provide a platform for these messages to get out there. And not all of them were vaccines are bad, don't vaccinate, but it might have just had a picture with some few words under it. For example, of an ill baby saying, well, this is what vaccines do. Here you go. Here's some examples of this. Gardasil, that's the HPV vaccine. HPV, of course, protects against cervical cancer and things like genital warts. But here you go, helping destroy the lives of little girls one injection at a time, or now boys too. And here's an example of of an ill child, with the implication that this was the vaccine that caused this. Now, in August last year, Pinterest changed its policy so that any vaccine-related search directs people to reputable sources. So that was really good to see that a social media platform had taken positive steps to try and avoid this.
And that just feeds into the conspiracy theory, doesn't it? You know, like, oh, they took this down because we're right.
Yeah, well, that's probably true. But, I guess you're never going to change the minds of the fundamentalists, but at least we can protect, those that are actually trying to find out true information. I think this is a role for all of us where we make sure that if we're, helping people, or if there's an opportunity to even talk about, in this case, vaccinations in a clear and concise way, and know where to direct people to, that's a really helpful conversation.
So how would you hold that conversation with, say, just a normal person who smokes and wants to quit, and they happen to say, oh, I'm not getting my kids vaccinated because my friend told me it causes brain damage. How would you approach that?
That's a really good question, and it's actually happened to me. I was at a park sort of fun day, and I was there with the smoke-free tent, and someone actually came up to me and they asked me about, what did I think about vaccines? And this is one of these situations where motivational interviewing, to just explore their points of view, can, really help. And it can help by starting off by saying, what do you know? What are your key fears or questions about vaccines? And this guy said, oh yeah, well, I heard they cause real problems. And I asked permission. I said, well, would it be okay if I tell you what I know about vaccines and the diseases that they're trying to prevent from occurring? So you don't have to jump in there and tell them that they're silly for not getting their kids vaccinated, because they're as confused as often we are about different things. And so just taking steps to try and direct people to the right sources of information to help them make informed choices can be really helpful. Spread of misinformation, a whole load of different ways, but often vested interests is at the top of this. And I said I'd go back to Dr. Mosley. Remember, he's sort of the first anti-vaxxer I talked about at the beginning. Apart from writing about vaccination, he also wrote about the benefits of sugar in coffee, in these so-called treatises on sugar and on coffee. It actually appears that coffee does have some beneficial effects on cardiovascular disease, but at the time, he practiced in Jamaica for some time, and he had financial interests in the sugar and coffee industry. So sometimes you've got to pick at, what's underneath some of these things. And vested interests are certainly key for some of these. Politicians, of course, have points of view, and they want to be in power. News media, gossip. I heard, or did you hear that? And then there are also, stories, works of fiction, essentially, that people misread as the truth. And these conspiracy theories spread really, really quickly. And to spread, it relies on rumor, and humans, it appears, we like to gossip. There's some experiments done in the early 2000s that confirmed the sort of consistent pattern of interest in gossip, often about others of the same age and gender. And if you had information that was either damaging or negative about your enemies, then that was really prized. Equally so was if you had positive news about your allies. That was also prized and likely to be passed on. So the more negative stuff you know that might be damaging about your not necessarily just your enemies, but maybe people that you have a differing opinion against, then that's great stuff to spread and pass on. So it seems we're kind of hardwired for this sort of gossiping, and it might serve to, in our best interest perhaps at some point in time, but not so anymore. So I know we all perhaps like to get involved in gossip and not on the rumor mill, but just be careful about what that might be spreading. And, in the hands of some, a little bit of information can be quite dangerous. And this is the Dunning-Kruger effect, which is really just cognitive bias in people with low ability at a task that overestimate their ability. So this might be confidence and confidence here. So the people that we worry about are those that don't know anything, but have lots of confidence in talking about what they don't know. And knowing a little or just a small bit with lots of confidence is really a recipe for disaster. Because here, this is where you get these this nonsense spread really quickly. Often you hear this as the peak of Mount Stupid, and some of the things I was looking at online. Really what you want is expert advice and being confident about this. And look, if you sort of know a little bit, that's no problem, but you'd be better off passing people on or passing them to sites or other people that can give them a little bit more information than pretending that you know something but you know nothing at all.
So the part where you've got Mount Stupid, that would be people who are really charismatic, really great speakers, and they talk about something they know nothing about, but it suits their interest. So they might be able to say, they might have a bleach factory, but they get a big audience and they say, if you drink my bleach, that will cure COVID.
Absolutely.
Right.
And that might be driven by, well, in that case, some financial interest. But sometimes you've just got people that have no financial interest, but they believe something, they know nothing about the topic, but they've got all the confidence in the world to speak about it.
Right. Yeah. And that's powerful, yeah?
We're very powerful and worrying there. And in terms of tobacco control and smoking cessation, of course, we've seen our times with misinformation. And of course, this is the CEs of major tobacco companies at the tobacco hearings standing up and promising that they say that cigarettes aren't addictive, or they believe that cigarettes aren't addictive, or nicotine's not addictive. They knew it was, but they lied. And of course, they had some vested interest there. These men, I think they're all men there, were certainly not stupid people. So they were lying to protect their interests in this. And I guess there's also, now, as we mentioned last time, misinformation about smoking and vaping and links to COVID. And as I was looking through information on bits and pieces for this presentation, this site popped up, and they're really, I think they were taking the other side where they're saying, look, all this talk about the science, we shouldn't be telling anyone that smoking's good, and that's true. So if you remember the webinar from last time, we were just exploring some of the data that seemingly showed that smoking was somehow protective against COVID. And that's not to say that we go and encourage people to start smoking, heavens forbid, no. But here, this site's saying, we should really clamp down on all of this misleading information. It's perhaps about how you spread the information that might be misleading as opposed to the science itself. And you'll see lots of this come out, you know, in media. So this was a study that found, just published recently actually, that found that electronic cigarette users or vapors were more likely than non-users to be diagnosed with COVID-19, get a COVID test and have COVID-like symptoms. Now, in this analysis, they found that ever users, ever vapors, were more likely to be diagnosed with COVID, which sounds a bit odd. You know, having one puff on an e-cigarette at some stage, maybe in the last month, would seem to be quite hard to say how that would be related to getting COVID. I think it just as a memory point here, that these types of studies can't prove causality. These are just sort of snapshots in time. And also this study relied on self-reported information. So there may be a little bit of a response bias here where people responding to this survey were for some reason more likely to get a COVID test. But the information that went out in the media, in blue there, the quote, teens and young adults need to know that if you use e-cigarettes, you are likely at immediate risk of COVID-19 because you are damaging your lungs. And so, you know, that's not really what the study found, but that's the message that gets out there into the community. And you can see how it really confuses things quite a lot. And I guess a cautionary tale from other studies with electronic cigarettes, and this one published in 2019, found an association between vaping and having a heart attack or a myocardial infarction. And here's the Daily Mail saying vapers who use e-cigarettes every day are almost twice as likely to suffer a heart attack, and they're even more at risk if they switched from smoking, meaning that if they were both dual using, they were even more at risk. So this caused quite some waves. Was this what the study showed? Well, not really. It was looking at associations, but it didn't look at the time point in which people had their heart attack. And certainly some of the people had their heart attack before they even started vaping. So that would be the wrong way around causality. And this paper was retracted this year. So again, it was removed from the journal because of the poor quality of the study. So we've got to be really careful, and it is hard to wade through all of this stuff, and possibly people's interest or motivation for showing this comes through sometimes, and sometimes science is not as agnostic as we'd like it to be. So again, what can you do in all of this, and how do you make sure that you're not spreading misinformation? Well, check the source if you can. If it's, you know, a blog or something like that, then that's not factual information. News outlets such as BBC or Guardian or Reuters are usually a better source of news information, but sometimes they rely on the media press releases from the studies themselves, so sometimes not always perfect themselves. Check the facts if you can, so do a little bit of fact checking and ask your colleagues. But I think above all else, and this is from a sort of campaign, take care before you share, pause. Just have a think about, is this really going to be helpful to people, or could it cause problems? And look, I know a lot of us often post on social media a little bit willy-nilly. I usually take a little bit of care before I post it. I'm not a great poster of a whole lot of things on social media unless I think that they're useful and are going to be helpful to people. So just think before you randomly post stuff. Help people understand the information that's available. And even though you may not know I'm not saying you need to be an expert in all areas, but if you come back to vaccines, point people back to the Ministry of Health website. That's got a lot of really good information on it. And try and, I suppose, help people understand the balance of risks versus benefits. And you're all good at this because you do this all the time. You do this when you're using NRT in pregnancy. You do this when you're talking about vaping versus smoking. And it's trying to support people to make evidence-based or informed decisions based on the evidence, and trying to weave way through the lies and the fake news and the craziness that's out there. And with health literacy, we all have a really important role to play. And I was reminded of this 3-step model for health literacy. Finding out what people know. You can ask them, what do you know about this? And then build the skills and knowledge based on that, and go back. Was I clear? Did that make sense? And if they don't, then you need to go back to that step 2 and go through some of those things again. But use those skills, ask permission, don't just force the information down someone's throat. That's not going to work that well. And take the stepwise approach. If you need to find out some information, here are a couple of good websites. Health Navigator I really like. There's lots of good stuff on there about a whole range of topics in health. And Healthline also has some topics that you can navigate people back to. So there you go. Don't believe everything you see. COVID-19's a hoax, 5G's the killer. You've got to laugh at some of these things, but for some people, it's kind of their lived reality. Anyway, that's for the session.
Okay, are you okay to take some questions?
Sure.
If anyone has any questions, just unmute yourselves and ask Hayden your question, or else you can use the chat function. Mine says it's disabled, Edward, my chat function. Is that something you can take care of?
Sure, not sure why. I'll check that out now.
Might be just me. So anyone have any questions? Just ask away.
Yes, I do. Hi, it's Karen here from Nelson. It's not so much a conspiracy, but I just want to ask, if somebody has given up smoking and they were using a vape and then they stopped vaping, and then say life throws a curveball at them 3 to 6 months later, is it better for them to pick up their vape and use that rather than go and say buy cigarettes? If that's, I do know that taking nothing would be better, but the choice of rather having a vape than a cigarette.
Yeah, absolutely. It would be the better option. And if they can, going back to smoking is by far the most harmful outcome of that. And if they're really having trouble, pick up the vape. And I often say that to people, even with NRT, it's, if you feel like you're going to go back to smoking, go back to your gum or patch first. If it's vaping, go back to your vaping before you go back to smoking.
Sure. And obviously it would be a little bit more better to say if you can go to a 0 nicotine, that would be better, because it's the nicotine. I was just wondering if that would be the catalyst for sparking that again.
Yeah, we don't fully know the answer to that question. Why not? If a 0 nicotine vape does it for them and that solves what they're looking for, but often they'll they get these terrible cravings, and so I'd still say, look, and if that 0 nicotine doesn't work, then go back to the nicotine. It's not the nicotine so much that's going to cause harm.
Okay, that's great. Thanks.
There's a question through the chat.
Gina. So speaking with GPs, it often worries me that they haven't done a full fact check before picking an option on some topics, i.e. vaping, that they then share with patients. When they have a strong view about a topic, how can we encourage them to look further into without being condescending? Yeah, it's tough, isn't it? And I see so many people that learn their facts from the Daily Mail And you'd think that GPs in particular, you know, wouldn't do that, but, you know, we're as susceptible as to anything, and we've probably all read crappy websites with, you know, dubious information. So it's, you know, if you don't have a lot of time to read about these things, then, you know, you're not going to go and look for those, hunt out those sources. So I suppose there's lots of opportunities for us to make sure that we're communicating what we know about, you know, facts if we're talking about vaping, and point out to them the sources where good information are available. So, you know, springs to mind, Vaping Facts website is a good place to look for those things. And sometimes, you know, our colleagues just aren't aware of those particular sites or information sources. So again, you might say something like, well, actually, what we do in our field of work is we use things like Vaping Fact websites or the NTS, and here are these sites. They've got some really quick, short videos that give you some of the facts. Grant, you're on mute, I think.
I am, yeah. One more question, if anyone has a burning question for Hayden. No, looks good. All right, well, thank you for attending, everyone. That was very informative, and just a reminder, that's been recorded. It will be up on our website in a couple of days, or tomorrow, sorry. But thank you, Hayden. That was great, and we'll see you in a month.
We will.
And remember, if you have a topic you would like Hayden to speak about, just email Edward or myself or NTS, and we'll make sure that Hayden considers it. And because if you want to know about something, I'm sure there's many other people who want to know the same thing as well. Okay, thank you, Hayden. Goodbye.
Bye.
Bye.